About the different types of threads and show you what we are talking about here. So here's an example of a mono thread. So as you can see, the mono thread has got a sharp needle tip that allows you to go penetrate the skin and just go subdermal, and then as you progress the needle in, it comes back and the thread gets left under the skin. And as you can see, this little thread is going to melt over time and stimulate collagen and elastin. This is polydiaxone, which is a common suture material that's used and has been extensively used around the world for the last 35 to 40 years. There it is. So if we place a whole lot of these little mono threads under the skin, you get tremendous stimulation, decrease in wrinkles, increase in skin thickness, improved quality of the skin, and thickening with collagen formation. So that's the idea behind mono threads. Okay. Now, sharp needle so you can get bruises. Downside, bruising. Here's an interesting mono thread. This mono thread is used in hyperdynamic parts of the body, like around the lips. So we can do a lip augmentation with this and maybe create a beautiful, beautiful vermilion border on the lips with a thread like this. So I'll just let the thread come off so you can see what it looks like. And there it is. It's corkscrewed. So as the tissue stretches, like the lip stretching, it goes out and in, out and in, out and in, out and in, out and in. So the thread can't migrate, or it's got little chance of migrating, because putting these fine little threads around the mouth area, typically they migrate and they come out like little whiskers at some point. So this corkscrew type of thread doesn't migrate. It's also good for putting in the nasolabial fold to volumize the nasolabial fold. There it is. Okay. Here is an interesting thread. This thread over here is typically a thread that's used in the nose, and you can see it's a blunt tip to reduce the amount of trauma. This tip is called an L tip, an L-shaped tip. And this thread goes into the nose, and then we retract, and you can see the little barbs that are orientated around the thread. Again, when it comes to nose threads, it's not so much about pull, it's volumization. So you're volumizing, and these threads typically just create volume and sharpen the nose bridge, but they don't really pull the tip of the nose up. Again, it's polydiaxone, it's purple. And the downside of polydiaxone is that if it's too close to the skin, you can see the blue discoloration. So the other benefit of a PLA thread, which is clear, that I'll show you in a moment, is that it's clear, so you can't see it. Here's a typical PLA thread. Again, you can see this is a blunt cannula, and this is what we call a W-shaped tip. And we take this off, and here's the thread, and this is a classic PLA thread. Clear, polylactic acid, highly stimulating. Actually, it's the same as Sculptra. It's the same substance as Sculptra, polylactic acid. And you can see the hooks, and they go, this is a bidirectional. The hooks are going one way, the hooks are going the other way. The pull is pulling, 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 pulling. And this is typically used for a cheek lift where there's lots of tissue to pull on. That's it.